Good afternoon. So let us have one more session of our YouTube and Instagram live. I have a case to discuss as discussed on the template which was sent to you all. So join in early so that we can start our case. And it's a very interesting case, which we'll discuss and how the interpretation of the remedies, very symptoms of the remedy is so important in order to get the remedy right. Everything basically in homeopathy, whatever theory you follow, whatever system you follow of healing, the interpretation is very important. If the interpretation of the patient's language in rubric form or in the form of a remedica is there, you'll be able to select the simulum every time. So interpretation is important. That's what I'll be discussing today. So welcome Dr. Ruchika, welcome Ruhi, Homeopathic Gem. So there was an interesting case. The patient was suffering from swelling under the upper eyelid. The swelling was too much. And on asking the symptom, the patient says that whenever she touches a part, that there is a pinpoint pain, there is discharge from the eyes, and there is a crust formation. So these were the symptoms basically which were there. Now, if you go symptom wise, that means the swelling of the eye is there, redness is there, discharge is there, and crust formation is there. Now, if you basically try to see these symptoms, you will get a lot of other remedies what I prescribe to that patient. In these type of symptoms, if you see, somebody will get belladonna, somebody will get ruta, somebody would get arsenic, somebody would get other remedies. But now what to look in this case is very important. Which symptom to look for prescriptions. Welcome Dr. Anvesh, Dr. Abhyang, Dr. Trivedi. Now which symptom to look for prescription is very important. And that will guide you to the remedy. A simple, can anybody guess the remedy? Of course, those who know the remedy don't tell, otherwise there will be no fun in telling the symptoms, Can anybody guess the remedy? In YouTube, Instagram, people are live now. The symptoms are very acute. It was an acute case of swelling in the eyes, pinpoint pain with discharge from the eyes, in front of the area of swelling with lot of crust formation. These were the symptoms basically in that. Which remedy comes to your mind? Anybody? I told you can think about belladonna, you can think about arsenic, you can think about ruta and other remedies. But which that remedy, that one dose which we basically want the remedy should work, that was given, and within about I think 12 to 14 hours the case was solved. Dr. Welcome Vishaka, Dr. Seth, welcome. Now the remedy which we are talking about is, first of all, how to enter these type of cases. See, the patient is telling you that there's swelling in the eyes, and this when I touch the eye, there is pain in this in one spot, in this spot, and then discharge with crust formation. I prescribed a single dose of Kali Bichrome. Kali Bichrome was given, I think 200 single dose. Next day morning, the swelling, the pain was gone, the swelling was gone, the eyes were absolutely normal. So how did we enter the case? Simple, a very three marking symptom of Kali Bichrome, and that is pain in the single spot can be covered with tip of fingers. The same patient had in his eyes. And see how this remedy was given and how did this remedy work in that patient. This is very important to know. The most important thing is how to interpret that symptom. Otherwise, you can never think about Kali Bichrome in eye complaints, because there are other remedies which are very, very symptomatically similar to the complaints which the patient had. Okay, so this is the importance of interpretation. Whatever your rubric you are taking, whatever symptom you are taking, make sure your interpretation is spot on. As you go in detail, welcome Dr. Roy, Dr. Vishaka, Dr. Babel, Dr. Venkat, Locacious Angel, Tamanna, SM482017. One more symptom of Kali Bichrome that you should always remember, a Kali Bichrome patient, most of the times in my practice, I have seen that she feels or he feels that something horrible something horrible, something, everything is horrible. That is a very important symptom of Kali microbe. The second thing which I have seen in my practice is there's a delusion, the child is dead. There's a delusion, the child is dead. And whenever you have this symptom, the delusion, the child is dead, think about only two remedies. Both are Kalis. One is Kali bichrome and the one is Kali brome. See this interpretation, because if you see Kali bichrome eyes, you would not see so many symptoms of Kali bichrome eye, but whether it is coryza, cough, asthma, diabetes, blood pressure, or cancer, the most important symptom to look for is the interpretation of the remedies 3 marking symptom. If you just open your Mater Medica and see in Kali bichrome, though it is written, the eyeball burn, they are swelling, the odematous, discharge is yellow, but in that patient who only prescribed through that symptom of pain in single part can be covered with tip of the finger. I do have the photographs of the patient also. Maybe in my webinars, in one of the webinars which I'm taking, I think next week 2 webinars are there. So I'll discuss the case again with the photographs also, so that you can appreciate how did we cure that case. So join me at the webinar is on the 16th, 7 o'clock Indian Standard Time, in the Hindi version of international, I think it's International Forum for Practice of Homeopathy, like that. So one question from newly detected diabetes with fasting 250, post-meal 450, with severe weight loss, not started allopathy yet, recently decided how to approach. Very nice, and it is very good. I'm very happy to know that you got this patient directly to take homeopathy in the first part. Otherwise, nobody comes to us when the sugar is 450 post meal. Make sure if the sugar is 450 post meal, you have to reduce the sugar first. Otherwise, the case may backfire and the patient might have ketones and he'll end up in ketoacidosis. In this case, first of all, ask what are the first presenting symptom. As you say, it is the weight loss. Ask the symptom, what is the symptom he's feeling because of the weight loss. So if you go in the repertory, if you go in the Mater Medica and see diabetes with weight loss, you have few remedies which are very, very important that comes to your rescue. Now, whenever the patient is suffering from diabetes, and basically do ask the 2 or 3 symptoms, like it is hereditary or anything else. So whenever there is total lot of weight loss with diabetes, you have to start with whatever I've seen. Acid force in LM potency, I start directly with 0/7 in repetition, and I also give Gymnema Sylvestrum in X potency 6x or 12x, 1 spoon twice a day for 7 days, and after 3 days ask the patient to test the sugar and the sugar will come down. When the patient settles down, do take the whole history, because today he has been diagnosed with diabetes, but it has developed few years back. So go back, ask the history of the patient, and you will be able to solve the case. As it is said, diabetes with a lot of pain in the body, think about lac. There's a remedy called lactic acid. There's a lot of pain in the body, because of that muscle loss. Or there's history of diabetes, think about carcinosin and sacramal. If diabetes is with heat, prickly, itching of the skin, think about cesium jumbolinum. If diabetes is because of liver complaints, think about urinum nitricum. And please write down, if there's diabetes in children, you have to start with crataegus. Very, very important remedy. Very good results I've got in my practice. And diabetes with lot of boils in the body, think about natrum phos. So these are the remedies, and this is how you approach, doctor. Okay, I hope you got some idea. Sir, I have a kidney stone. I need some help. Yeah, definitely. Reports, symptoms in the region of kidney, those are very important to prescribe. Dr. Rehana, welcome. Dr. Roy says, sir, person have infection in wisdom teeth. Infection is there. Antibiotics and painkiller are going on. Can we give some of the medicine? Yeah, definitely. If there is infection in that, normally, if that is the case, normally I give calendula mother tincture to apply in that area, and it works wonderfully. It works wonderfully. And if it is infection, make sure how is the infection and what has affected in the infection: the teeth, the gums, the crown, the enamel, and depending on that, you can think about remedies like Hecla lava, Cephysagria, phosphorus, conium. There are other remedies also. Yeah, Dr. Venkat, you can think about Crataegus. Normally, I used to prescribe Crataegus in 30 potency, but now I start LN potency. I start from 0/3. Uh, okay, doctor. Yeah. Female 55 complains of both pain with loose teeth, swelling on that side. Patient complains easily breaking of teeth. Uh, Post menopause. Yeah, so this is a case where the patient has very brittle teeth. It breaks. Of course, post menopausal is a very important symptom, and that is important because the calcium is that there's lots of calcium, there's hormonal imbalances there, and these type of complaints you have to take care, because this will add up to your what you call matermedica. In this case, do think about 3 4 remedies, very very important. Please write down. First is calcarea fluor, second is fluoric acid, third is plumbum metallicum, and fourth is radium brome. Very very important remedies. Now, when the teeth are crumbling, when the teeth are crumbling, few remedies apart from this which I have got very useful in my practice is Calcarea fos, Staphysagrea, and Thuja. Crumbling teeth, that's important. Valeriana Mendonica, welcome. The seeker, welcome. Kill says, good afternoon, sir. Anger with repentance ki medicine. I have taken Crocus sativa and Lycinum. See, whenever there is anger with repentance, now, if you take Crocus sativa, it has a very, very high, from the highest hilarity to the deepest despondence, that is Crocus sativus. Now, it is said that whenever there is anger and the patient is appeased very easily, उसको जल्दी दिल को जल्दी माफ कर देता है, सब कुछ ये कर देता है वो. Do think about one of the important remedies that come to my mind is phosphorus. Think about phosphorus first. So Venkat says, my mother-in-law is doing well with my medicines and cough and cold. Thank you so much. Thank you, Venkat. So some questions on Instagram, on YouTube has scrolled up. So if you can do right. Lycinol, see, lysine is a very important remedy for Dr. Akhtar, but lysine anger with repentance is not easy, and it takes time for lysine to come back to normal state. So that's why I would not put lysine in that area, because lysine is a very very angry and very very bad that type of remedy. Remedy for thrombocytopenia in old people. See, whenever you are treating case of thrombocytopenia in people, I normally feel more low. Lots of cases come to me. First is sulfur, second is ferrum metallicum, third is phosphorus, fourth is one of the snake remedies I prescribe. Sir, what importance to be given in forked? Yeah, urination stain. Yeah, what happens, in these type of cases, Valeriana, you make sure that the patient is not suffering from stricture. Stricture may have different types of urination: forked urination, dull urination, urination drop by drop. So every time the urination is forked, then take the symptom. Otherwise, one time forked urination, sometimes split urination because of the stricture or prostate problem, then there'll be a problem because the cause is something else. So treat that first and take the whole case in that case. Girl of fire, vomiting, whatever, eat or drink. Yeah, whenever you have this type of cases, do think about ferrum metallicum, think about magnesium carb, think about ethusa, senna, all lot of remedies. Remedy for thrombocytopenia. Yeah, see, now I hope I am not answering very fast because some of the questions are not answered. That's why. Now, whenever you have, if I would like to complete the question of Dr. Valeriana, if you want a specific remedy where the urination is forked, it is forked stream. There are 3 4 remedies which are very very important that come to my mind. First, I would say Thuja. Second, I would say Merxol. Third, Mercor also, and of course, Canther is always there. But recently, I had a case, though the patient was suffering from minute stricture, but every time the urination was forked, and now we took the case and I prescribed, which remedy? Rustox. And Rustox beautifully covered the case, and the urination was better, the stricture is also better. Now the patient does not have to go for dilatation. So this is how basically you will be depend on your symptomatology. Cyber, welcome. Allergic rhinitis, sneezing as soon as he wakes up. Just a minute. Good afternoon, sir. Anger with, you finished that. Thrombocytopenia. Good afternoon, Dr. Vaishnav. Allergic rhinitis, sneezing as soon as he wakes up. Now, if the patient has just sneezing as soon as he wakes up, soric symptom, don't give any medicine, Just wait. If it is troubling, then only give, Otherwise, just sneezing, general I would not like to give the medicine and suppress that sneezing. So, but whenever if you want and if you think that a patient is troubling you because she's not getting the relief, you can think about ammonium carb is there, calcarea carb is there, kali carb is there, and arsenic is also there. So you can think about ammonium carb, when I listen a song, it always repeat in mind, and also that's why I okay take crocus. Okay, it's repetition. No, crocus has basically crocus is made from saffron. There's a wide difference from the highest hilarity to deepest despondency. So the alternating states is more important in crocus than the anger. Okay. If a person feels pain in hamstring region only, he presses that muscle area. Normally, no pain during walking or sitting. That means the patient is suffering. There's an inflammation there, and whenever there's inflammation there, do think about 3-4 remedies. First is MacFoss. Second is you think about Rustox. Third, think about belly spur, and fourth, think about Ruta. A patient is having hypothyroid, but now her thyroid report normal. So now what to do? Whenever you are prescribing medicines and if you feel that with your medicine the patient is better with the constitutional dose, not the repetition of thyroidinum 6x or thyroidinum 1m 3 times, don't do that way. If you are constitutionally selected the remedy and you feel the remedy is right, then you can wait and start tapering the allopathy medicine and keep doing the reports after every 2 months. In 6 months, you taper off the medicines and seeing the reports, you can wait. Though it is 5.5 normal, it should be with your remedy 2.5 to 4 इसके बीच में रहना चाहिए, and that then you can taper off the medicine gradually once in 2 days, once in 3 days, once a week, and then stop it. Dr. Payal, welcome. Loud eructations after pressing anywhere of the body. Yeah, this is a very very common symptom which we get a lot of. That means there is a lot of accumulation of acid level, bicarbonates in the body, and the body is more of acidic. Whenever the patient is not able to digest something, some thought, and he requires a lot of counseling to liberate that thought out of the body, whatever he cannot digest mentally. In these cases, I have seen a lot of these type of complaints where accumulation of bicarbonates or the body becomes more of acidic. That's why whenever he presses, he gets eructations and hiccup. Atharva, Homeocare, yeah, welcome. So your suggestions are, thank you so much, Dr. Ronnie. And I am very happy that just chatting with you all only, I also brush up my Mater Medica, and it's very good for me also to know that I can answer few questions extempore. Otherwise, no, normally we are so used to programs and now repetition chart that we are always use the repertory, but it helps me also in my practice. So it's a both way traffic. Thank you so much, Dr. Poraview. 14 years girl scratches herself every time her parents say her to read her lesson. She admits that she does not, that is, order her parents to feel sorry for her and stop to. I didn't get the question. 14-year-old girl, she scratches herself every time her parents say her to read her lesson. She admits that she does that in order her parents to feel sorry for her and stop to say, okay. Now, this is a very common, gimmick, a very common excuse that हमारे में बोलते हैं ना बेचारी लगना, that she basically desires sympathy. Now, why you are troubling me? So a girl basically she's desire sympathy. There's a rubric called sympathy desires. Now this is very important to understand. This is called sympathy desires for. And sympathy desires for, there are few remedies which should be thought of. Actually, whenever the patient complains about something, every symptom relates to a rubric. So company desires, do think about phosphorus, camphor, helleborus, CPR, tuberculinum. These are very important. And you have posted a very 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 what you call symptom of the patient, which is exactly written in the Mater Medica, Dr. Purvayu. It is written that the patient desires sympathy, especially in children who are studying. See, word to word your symptom is matching. And the remedy written in the remedy is that Brata carb is there. Welcome, Dr. Madhuri, Dr. Vashi, Matharva, welcome. Good noon, Dr. Prajapati. So I hope, Dr. Purvayu, you got the answer. Word to word, written in books. Children does not want to study and desires sympathy, Brata carb. But that's only, otherwise Brata basically are mentally like Brata, they don't know, they don't want to read because it does not go into the head. So they become bored. So they find out reason not to study. And this is the one of the reason they basically start. So see, such a homeopathy, mathematics is such a beautiful thing, whatever symptom you take of the patient, it is word to word sometime written in the book. If you had done my webinar on last week, I had basically presented a case of viola odorata where I had used the rubric emotions needs to be controlled by the intellect, and we prescribed viola odorata, and that was a fantastic case. One of the best case of Malay of CD which I cured with viola odorata, and that case gave me a lot of confidence in understanding the patient, then converting the patient's language into the rubric or the mathematical form. And you'll be surprised that the same wordings is written in Herring's Encyclopedia, Allen's Encyclopedia, Herring adding symptom, Allen's Encyclopedia, and Lippi's Mathematica. Word to word what the patient says. This is the beauty of our Mathematica. Salam Jahan doctor, can you tell us your experience of treating advanced ovarian cancer? Yeah, there are few cases in my practice which I have been treating of ovarian cancer. A few are better, few are just improving, and few are status quo. In this case, in ovarian cancer, I have seen hormonal level plays a very important role, and at which time the patient suffered from cancer. Is it pre-menopause? It is before the menopause or the after the menopause. In lot of cases, doctor, I have seen that you have to prescribe the remedies called as progesterone, estrogen, and testosterone. Now, this remedies because some patients basically have been taking a lot of contraceptive pills in order to delay the pregnancy or does not want to become pregnant. In this case, also the hormonal cycle is disturbed. In lots of cases, we have seen that the patient takes the medicine to suppress the menses because there are some functions in the house or she does not want the menses. That's why they have taken the medicine. And sometimes, the patient basically have a lot of facial hairs and male-like features, and again menses problem. So testosterone works in those cases better. So it is a very very important hormonal inflow in this case. So in this case, do think about these remedies: progesterone, estrogen, testosterone, folliculinum. These are the the remedy. Ovary is there in lots of cases where we can give intercurrent ovarian remedy, and lot of cases where there is history of thyroid and the patient had hypothyroidism during pregnancy, and after that she developed thyroid problem. In this case, thyroid also works very well in these type of cases. So the hormonal influences I have seen in case of ovarian cancer is very very important. Of course, if symptoms match and the symptomatically the patient you find the remedies are working, you can give these remedies. But these hormonal remedies you can definitely use as an intercurrent in case of ovarian cancer. I have got very good results. The patients are still on and they're very happy in spite the cancer levels are still there, but they're very happy without chemotherapy and without other type of treatment. They are with me in homeopathy medicines. Oh, that was a long answer. So it was, what's the best medicine for misdirecting lymphedema with chronic indigestion urgent urinary? Yeah. So best remedy means whatever remedy you have selected on the basis of individualization and the patient symptom is the best remedy. Mesenteric lymphadenopathy, lots of cases comes, especially of children. They have a lot of pain, and also there are some remedies which you have to think in these type of cases where you should get good results. Now don't only think about the pain, do think. Doctor who's there, Dr. Vashi, do take the modality of pain. When is the pain? It is morning, it is evening, more in the night. When is the pain? Because of anger there is pain, or maybe after eating something there is pain, or whenever there is tight clothing there is pain, taking cold drinks there is pain, and there are a lot of, or this coughing there is pain. So there are a lot of other modalities you have to see. For example, if the patient has pain in lymphodema after a lot of coughing, think about bryonia, think about lachesis, think about phosphorus. If the patient has a pain after drinks aggravation, then think about rust ox, think about causticum, think about arsenic. If children have pain and simple pain, there is no modality, you can think about pulsatilla is there, I think nux is there, mercury is there, ipecac is there, and belladonna is also there. So try to differentiate the pain, the time of pain, the modality of pain, and then you'll be able to understand the case properly and then prescribe, add to the thermals of the patient, the likes, dislikes, and then you get the remedy. Good afternoon, Dr. Vishal. You have joined, yeah, I think you have joined very late. It's already 3:25. Dr. Raha, I hope you got some inputs of the answer. These are very, very important things which I have seen in my practice, so I'm just sharing it with you. Dr. Gulab, yeah, welcome. So I hope this ovarian cancer is, intercurrent. Yeah. See, either you get, see, if you have got the constitutional remedy right, and you find that what cure you were expecting or what relief you were expecting, you are not getting it, it may be because of some cause which is not letting the patient to get cured. And this patient, go back and see whether they had taken a lot of hormonal pills, either to suppress the menses, or they had taken a lot of pills in order to conceive of a pregnancy, or the patient had taken a lot of hypothyroidism and a lot of thyroid tablets since conception. So, and patient has unwanted facial hairs and PCOS symptom, so testosterone would be in. So these are various things, if you get a block in spite of selecting a constitutional medicine, then these remedies, depending on the symptom, you can always prescribe and get relief in this case. That is very helpful. So a very interesting question, of late you get a lot of cases of ovarian cancer, uterine cancer, and all the patient comes to us after they have taken all the conventional treatment. So it's important on our side basically to give relief on the first dose, and that's why these remedies are very, very helpful in my practice, and I'm using it now. Good afternoon, doctor. I didn't get the name. Fatima. Yeah. Medicine for skin tag. Very, very difficult case. Fatima, medicine for skin tag. Sometimes it is said the skin tags are because of aging of skin. And there are some remedies, homeopathy remedies like Thuja is there, Sabana is there, Calcarea floor is there, which may or which may not give relief. In my practice also, some cases response, in some cases do not respond also. If there is a hereditary of skin tag, lots of skin tag in the family, I normally start with Medorinum or Thuja depending on the patient's personality. They said, it is said that in spite, if you take chemotherapy also, sometimes the patient cannot bear it. And sometimes, what I feel that sometimes doctors written that you take cisplatin, trifluorosilol, cobaltum, or some remedy or some prescription is there of chemotherapy, and the patient not able to take. Sometimes, what happens, the remedy like cisplatin or cobaltum, which is again a remedy for cancer complaints, cancer remedy side effects, these remedies also come to play in our Metermedica. They are there, but most of the cases I have seen, these hormones is very important. And if the patient does not go on to for chemotherapy, you can explain the patient that in spite of chemotherapy not going to get cured, instead you can try homeopathy, and it will definitely work in most of the cases. They said yes. Sometimes the answers become very fast, because I have to answer a lot of questions, and the remedies also sometimes does not come to my mind very fast. What is the first medicine you mentioned? Cisplatin, CISPLASTI. It is basically a what do you call it? Chemotherapy remedy. Cisplatin, cobaltum, 5-fluorosilol. These are the medicine given for chemotherapy. Now cisplatin is used. That's why we have a remedy for that also. A lot of people, have a lot of side effects with cisplatin, and whatever remedy we give, it does not work. Then we have a remedy cisplatin also that works. That's that tautopathy type, and it works and helps in reducing the symptoms of the patient. CIS, not CYS. So, any other question? Dr. Arman Khan, welcome. And there are some of the patients who also have joined, so they also welcome, and it's very encouraging that patients also want to learn what is homeopathy, and they also like seeing the doctor, on talking something about disease and something about cures, because they are very happy in hearing that homeopathy can cure this also and cure this also. So everybody is welcome. Any other question? Anybody? I think next time I'll start answering slowly, otherwise there are so many questions I answer so fast, and There are no questions left. It should not have been like that, because questions should always be there. So I think it's the half an hour is up, and I think we have I've tried to answer most of the question. Again, we had a very good response from Dr. Venkat, who says that his mother is very well after treatment. So keep sharing your remarkable cures, and that will boost everybody, including me, to practice and become a better homeopath. Okay. So thank you everyone. Thank you for joining. Until next time, meet you on next Saturday. In between, you can join my webinars, which are continuous every week. I have one or two webinars, so keep joining. Okay. And thank you so much.